What's up, guys? Welcome to episode 51 of the unofficial NCLEX podcast. This episode is entitled Implement Seizure Precautions for At-Risk Patients. This is a big deal, guys. A lot of things can cause seizures, and some things you wouldn't even think could, and they can occur unexpectedly with no warning, and if you're not already prepared, you're kind of out of luck, and you're kind of scrambling. So it's really important to initiate these precautions as soon as it's necessary. So first, I just want to go over a couple things, a couple disease processes that can put people at an increased risk for seizures. So anytime there is injury in the brain, stroke, tumor, surgery, anything going on in the brain, if you irritate the brain at all, you're at risk for seizures. So it's something that, if you've got a neuro patient, you should be watching that closely. And a lot of neuro patients, part of their standard order set is seizure precautions. Okay. Some drugs and medications can do that. A big one is withdrawing from alcohol or other drugs or medications. If you've got someone in acute withdrawal, they're at risk for seizures. Fevers, especially with children, but if fevers get pretty high, you can have seizures from that. They may have an existing history of seizures themselves, so keep that in mind. I actually, on the PDF, included a list from Johns Hopkins of a ton of different causes of seizures, which I thought was pretty comprehensive, so I encourage you to check that out. So again, these can happen with little to absolutely no warning. I've had patients just suddenly have seizures before, really catch you off guard. There are a few things that are most likely incorporated in seizure precautions at your facility. And I put the big ones here. Padded side rails, okay? Because if someone is having a seizure, they can injure themselves. So our goal is to prevent injury and maintain their airway, okay? So we want to have padded side rails with all four side rails up. And I know what you're thinking, I'm not allowed to have all four side rails up. That's not allowed. Well, if someone has seizure precautions, that typically overrides that whole you're not allowed to have four side rails up thing, because we're worried about them going into a seizure and then falling out of bed. So check your hospital's policies and procedures, but most places will say, hey, if they're on seizure precautions, then we not only we want the side rails up. And the next thing that's really important is having suction already set up and ensuring that it works appropriately. So what happens when someone has a seizure, they can have a lot of oral secretions that they could easily choke on because they're not maintaining their airway necessarily or breathing appropriately. And what we want to do is, if we see someone having a seizure and maybe having secretions out of their mouth, is we want to use suction and get rid of those so those don't go down their trachea. So it's important, and I've been in those situations where someone's suddenly seizing and we need suction right now. There's not time to go to the stock room, go get the suction supplies, set it up, turn it on, make sure, you need a few things to, the canister, the tubing, the everything that goes with it, the piece you actually put in the patient's mouth. There's quite a few things to put together. So if you haven't already done that, you do not have time to do that when you need it. And a lot of hospitals actually have standard rooms set up, suction is set up and works appropriately. So ensure that is done. And then the other thing is having an ambu bag nearby, and that again is pretty standard in hospital setup rooms, but it's especially important with patients who are having seizures, because you may actually need to intubate them, because they may, if you can't break the seizure, or if you have to give a ton of meds that are compromising their ability to protect their airway, they may need to be getting intubated. So that's something that's really, really important. So your priority with your seizure precaution patients is safety, and you want to do that by implementing seizure precautions for patients that are at risk. And typically that includes padding the side rails, having all four side rails up, suction, and an ambu bag. So that concludes the episode on implementing seizure precautions for at-risk patients.
This has been another episode of the unofficial NCLEX Prep Podcast. To get the massive PDF guide that goes along with this podcast, head over to nrsng.com/NCLEX Prep. That's nrsng.com/NCLEX Prep. That's a free download that you can take with you anywhere, and you can basically have this podcast in text format. Our goal here at NRSNG.com is to give you the tools and the confidence that you need to succeed in nursing school, on the NCLEX, and in your life as a nurse. We want you to succeed, and we want you to become part of this movement of nurses that is dedicated and motivated to learning and becoming the best nurse that they can possibly be. My name is John Haas, RN CCRN, and I'm the founder of NRSNG.com, and I sincerely thank you for being here, and I'm so proud of you for taking this step in your journey. Now you know what time it is now. It's time to go out and be your best self today. Happy nursing.